Hello everyone. Now we are going to see about some more dermatological conditions which are high yield in USMLE exams. So let's talk about Marjolins ulcer. What is a Marjolin ulcer? Marjolin ulcer is when there is a scar and that gets converted to squamous cell carcinoma. That is a Marjolin ulcer. So Marjolin ulcer is the one which arises from a previous scar and progresses to squamous cell carcinoma. So they will be giving you like the vignette will be like a 70-year-old female with a long-standing chicken pox on the chin, and there is a recent abnormal growth within the established scar tissue. So what does it mean? It means that it has progressed to squamous cell carcinoma. The biopsy is the next treatment. Lichen sclerosus. What about lichen sclerosus? Lichen sclerosus is the one which develops with white vulvar patches. In lichen, we have already discussed about lichen simplex chronicus and lichen planus. This is the third one, which is about lichen sclerosus. The other videos are in my dermatology playlist. You can have a look at it. The lichen sclerosus, why is it happening? The reason is it can be any reason. It can be genetic, it can be autoimmune, or it can be hormonal. Like low estrogen states, the lichen sclerosus happens. So that is different. But how will it present? The etiology can be anything, but the presentation is it will be presenting in the vulvar. It will be rough. It will be patchy. It will be white or gray or sometimes even red, but gray and white are the most pathognomic. It will be itchy. So this is how lichen sclerosus will present. Will it be ulcerate? No, it will not be ulcerating. You can check in the internet. We have many pictures of lichen sclerosus. Due to copyright issues, I am not posting here. And will it be itchy? Of course it will be itchy. Will it be ulcerated? It will not be ulcerated. If it is ulcerated, then it means that it is vulvar carcinoma. So with the same pattern, like I told you now, the rough, scaly and gray white, there is another disease, that is it can be squamous cell carcinoma too. So first we need to do a biopsy to confirm that it is lichen sclerosus. Then if it is lichen sclerosus, since autoimmune etiology is also possible, topical corticosteroids are effective in lichen sclerosus. What do you mean by lichen? Lichen refers to skin disorders causing patches of white, thin or a wrinkled skin appearance. Sclerosis indicates hardening or scarring of the affected tissue. This is how exactly a lichen sclerosus will be. What is keratoacanthoma? What is the word? So this is how a keratoacanthoma look. It will be similar to squamous cell carcinoma, but it is not a carcinoma. Fine. So let's see what is keratoacanthoma from its name. Kerato means keratinocytes. Acantho is spinous. Oma is growth. So when there is a growth of the keratinocytes, acantho is spinous. That is, the keratinocytes are those which are present, which are produced from the stratum basale, but as it progresses superficially from stratum basale, stratum spinosum, stratum granulosum, stratum lucidum and stratum corneum, as it progresses superficially, it will be differentiating into keratinocytes, and by the time it reaches a superficial most layer, it forms a full-blown keratinocyte. So now in the stratum spinosum is a layer where it is beginning to produce keratinocytes. So hyperplasia of the keratinocytes that are present in the stratum spinosum, that is keratoacantho. Kerato is keratinocytes, acantho is spinous, and oma is growth. That is what is keratoacanthoma. Here the keratinocytes are produced, which is seen in the center layer. So this is the 65-year-old female presents with this condition, and what it is keratoacanthoma. So how will it be? This will be having a characteristic hyperkeratotic core will be there, and it will be surrounded by an inflamed skin tissue. So what is the treatment? Surgical excision is the standard treatment, but even if left untreated, it may self-regress. What do you understand about Nevocystic Nevus? Nevocystic Nevus can be translated as a benign mole, as this. So they will be showing you a picture like this and asking you a 23-year-old male who has a 1 centimeter stable lesion on the arm. The family history the uncle died of melanoma recently, and the lesion is unchanged. What is the next best step? So to determine what is the next best step, we have the ABCDE criteria. A stands for asymmetry. What do you mean by asymmetry in a mole like this? A line has to be drawn through half of it, and both the halves should be compared, assessing the shape of it as well as the color, comparing both the halves. So if there is any problem with the symmetry, then the excision should be done. Then we need to see the border, whether it is smooth or it is invaded, and see the irregularity, border irregularity, color variation in this, that stands for C. D is diameter. When the diameter is more than 1 centimeter, then it has to be excised. Whether there is any elevation changes, E. So when all these are assessed and the lesion lacks any features of malignancy as this, then observation is the appropriate treatment. The term nevocystic, nevus means mole and cystic means cells. It refers to the melanocyte cells that produce the skin pigment, and it is non-cancerous. It is a common mole. What is about this? What do you know about suspected melanoma? When there is a suspected melanoma, then excisional biopsy is done. So where does this happen? This is the one which is present on the leg. That is not on the cosmetic area, like in the face and the neck. It is not present. It is present on the leg or the hand. In such cases, excisional biopsy is the treatment. What is excisional biopsy? Excisional biopsy is a full thickness biopsy where the full thickness, that is the dermis as well as the hypodermis, along with some subcutaneous fat, is removed. In addition to it, the entire lesion is removed, that is excised. So that is the excisional biopsy. This is done when it occurs in places other than the face and the neck. But when it occurs on the neck, then punch biopsy is preferred for neck lesions, where a punch, that is a full thickness, the dermis, hypodermis as well as the subcutaneous tissue is removed just like a punch. It is a type of full thickness biopsy, and that biopsy is analyzed. After that, what is the next procedure that is done. What do you do for facial lesions? Most micrographic surgery is done to confirm melanoma, to preserve the cosmetic appearance and ensure clear margins. Where will the punch biopsy done? Will it be done in the middle or else in the side? The side of the lesion is chosen for biopsy because in the middle it will be mostly necrosis or ulcerated, and therefore we may not be giving a clear picture of it. Therefore the side of the lesion is assessed. What do you know about shave biopsy? Shave biopsy is generally given as an option in exams, but in shave biopsy, the dermis, the epidermis and a part of the dermis is just partially removed. The full thickness is not done over there. What is the key prognosis for melanoma? Whether it is lymphocytic infiltrate or the depth of the lesion. Depth of the lesion is the most important factor which determines the prognosis as well as the staging. What is Aldesleukin? Aldesleukin, interleukin 2 is the therapy for melanoma. What is interleukin 2? It is what is Aldesleukin? It is a recombinant interleukin 2 which is used in melanoma as well as in renal cell carcinoma. So they might give you a 32-year-old female with a confirmed melanoma receives Aldesleukin therapy. So this immunotherapy will harness the body's immune system to fight the cancer cells. Interleukin 2 normally stimulates the T cell proliferation and activation, enhancing the immune response. What is this? This picture can be given and the diagnosis can be asked. Acral lentiginous melanoma. What is acral? Acral stands for the hands or the feet. Lentiginous can be translated to a spot, and melanoma is something similar to this which you know. So in acral lentiginous melanoma is much more common in African American population. So the question can give you 30-year-old African American female has a lesion as shown below. The area is not typically sun exposed. So this has a high suspicion for melanoma, whether the sun exposed or not. So that's what you need to remember. What is subungual acral lentiginous melanoma? As the name says, subungual, it is below the nails. Acral is on the hands, on the extremities. Lentiginous can be translated to a spot, and a melanoma. So you should know that subungual acral lentiginous melanoma can present in this way. Again, the Acral lentiginous and Subungual lentiginous are much more common in Asian American population. What is glomus body tumor? Glomus body tumor is a cold sensitive nail pain. So they will be giving like a 29-year-old male with a nail bed lesion and radiating pain triggered by cold temperature. Then it is a glomus body tumor. The glomus body tumor contains modified smooth muscle cells in the fingers and the toes that will assist in thermoregulation. So therefore, when there is a growth and that is being cold sensitive, then we know that it is a glomus tumor. What is lentigo maligna? Lentigo maligna is maligna. The word maligna means that it is melanoma in situ. That is, it has not progressed to a full-blown melanoma. So you will be given a lesion like this, and 67-year-old male with a facial lesion. Biopsy shows malignant cells growing laterally along the basement membrane without dermal invasion. So this clearly shows that the melanoma is not progressing deep, but then it is present in situ. So in situ presentation shows it can be translated as lentigo maligna. Melanoma in situ will have a lateral growth in the stratum basale, but it will not be invading the straight basement membrane. When the invasion occurs, then it goes to full-blown melanoma. That is lentigo maligna melanoma. When the word lentigo maligna melanoma is used, it means that it goes into a full-blown melanoma. But if only lentigo maligna means, that means melanoma is present in situ. That's what it has a progression risk. Lentigo maligna has the progression risk to become malignant melanoma once the dermal invasion occurs. What is Vemurafenib? Vemurafenib is BRAF kinase inhibitor. BRAF is the oncogene which causes serine threonine kinase signal transduction leading to melanoma. So, when Vemurafenib is given, it will inhibit the mutated BRAF kinase activity. What do you know by seborrheic keratosis? Seborrheic, the word seborrheic means that it is a greasy. That is what it means. So this is how seborrheic keratosis will be. So what is it? Why should it occur? It generally occurs in sun exposure, advanced age, sometimes even low immunity. It will look as if the greasy or waxy growths that appear can be peeled off. It is not malignant, it is only of cosmetic concern, but except for one case where it is sign of lesser trellat, where there is sudden eruptive seborrheic keratosis. All of a sudden there is eruptive seborrheic keratosis. Then it means that there is an underlying visceral malignancy, preferably that's what underlying visceral malignancy. So when there is a sudden eruptive seborrheic keratosis, then it means it is visceral malignancy. Otherwise, just seborrheic keratosis, one or two in the face or in the neck, it is non-malignant and it is benign. It can be removed for cosmetic concerns. With this, we have come to the end of our presentation. So I hope I have made it clear. I am a medical doctor, I am an anesthesiologist. If you like my videos and if you are a medical student or if you are preparing for MLE exams and if you want me to mentor you or get mentored by me, then you can send me a message in the comments. I am looking forward to see you succeed. Have a good day.